Hi everybody. It's been 12 weeks since I had my surgery on my neck for the C2, C3, no, the C3, 4, C4, C5, C5, C6. As you can see, I'm doing great. I'm having to wear this bone stimulator because when my daughter took the X-ray, the doctor took the X-ray. He noticed that on the C3, C4, it wasn't fusing like it was supposed to, so he recommended that I wear this until my next appointment. And this supposedly stimulates the bone. As far as the surgery is concerned, I'm doing great. Sorry, I don't have any pain on my arm. My numbness is gone. I can move my neck left, right, up. The only thing that I've noticed now is that I can't touch my chest with my chin. I have like about maybe an inch and a half. I can't touch it as before I could, so I guess that metal brace that they put in there with the screws doesn't allow for the flexibility that I once had. But other than that, I'm feeling great. Pain. I'm still on. The doctor won't let me go jet skiing, go hunting. I can't do anything until he gives me the okay. And from what I understand, it might even take a whole year before the whole bone fuses completely like it's supposed to. So I'm pretty good about not picking up heavy stuff. I'm taking care of myself, and once the doctor gives me the green light, then I'll start working out again, doing jet skiing, hunting, golfing, doing all the stuff that I used to do. As far as the surgery is concerned, from the first video, I did mention that as soon as you have that surgery, it's really important that you wear your fiberglass brace and you also wear that foam brace. People ask why I wore them both, but it just gave you more support, more stability. Because the problem when you don't have that is that what happens is that you have uh, when you're getting out of bed, you have a hard time lifting your head. So without it, you have to literally just grab your head and lift your head up because your head weighs about 18 pounds. So that's a lot of stress on your neck after the surgery. But when you wear that foam brace and that fiberglass brace, it pretty much supports your head completely. So you can pretty much get out of bed no problem. Also, what I use like an inclination for a bed or a recliner. But I had one of those sleep number beds that I could prop up my bed like a hospital, and that made it more comfortable and easier for me. Some people don't have that. They might have to use a recliner, and if not, the worst case scenario, you're going to have to sleep on some pillows. I wore that brace for exactly 6 weeks until the doctor took it off. So 6 weeks is about what you're going to wear it for, and I slept with it on. I use it all the time. It's really important that heals like that. Uh, also, make sure you find a great doctor. I found this Dr. Veery up in Dallas at Texas Spine Consultants. Great doctor. I did a lot of research on him. He was voted Doctor of the Year, best doctor in Texas, best doctor in the country several years running. So I did a lot of research. So if you're not from Texas and you're from somewhere else, it's real important that you find a doctor, do research on him. Just don't go to any doctor. I had a doctor do surgery on my father 10 years ago. I mean, he's already gone, but after his surgery, he caught pneumonia because his doctor messed up his esophagus. The food was going into his lung. He was he had pneumonia for 6 weeks. They had to induce. They put him asleep for 6 weeks while his lungs cleared. They messed up his vocal cords. He couldn't talk. He would sound like the Godfather. You would have to whisper like this. I mean, he was horrible and miserable. This guy just completely messed him up. So when I spoke to my doctor, I asked him about these, and he just laughed and said, "Hey, listen, I've done thousands of these. Don't worry about it. I have a neurologist in the hospital room who's monitoring your nerves. I have the anesthesiologist, not the assistant. He's in there monitoring you also. Don't worry." And sure enough, the next day when I woke up from my surgery, I was completely fine. I mean, my pain was gone. I had a little soreness on my throat and from the cut, and moving your head because you're sore. But it's important that you always keep that brace on no matter what for 6 weeks. You can take it off for a little while, but for the most part, leave that on for 6 weeks and you'll be fine. Here's a photo of my X-ray. You can see right there, and that is the metal he put in my throat. It's focusing right there, and you can see the bone in between the screws, and that's cadaver bone that he used. And that X-ray was taken after 6 weeks. So I'll be taking another one in next week after 13 weeks to see if they're fusing completely, and see if he gives me the go ahead on removing this thing. And this thing what I'm wearing here, if you can see right here, it's called the let me see if it's focused on there. It's a cervical stem right there, and that's used to stimulate the bone, because I was, like I said, I had a little bit of I didn't have enough bone growth on the C3, C4, so he recommended this. But other than that, if you have any more questions, like I said, I'm feeling great. I can move my head up and down. I just have a little loss when I can't really, my chin can't hit my chest. I don't know how it's going to affect my golfing. But other than that, I feel great. So I highly recommend doing the surgery. I've seen other videos where people were complaining about their throat and they can't move their neck and they're sore, and I didn't have any of those problems. If you wear your brace like you're supposed to, and you'll have a little bit of a problem swallowing the first 2 or 3 days, but you know, the first 2 weeks are probably the roughest, but it ain't that bad unless you wear and follow the doctor's instructions, and most important, find a good doctor who's done thousands of these surgeries, and you know that they can do them with their eyes closed, and research them first before you have the surgery done. But I'm living proof that it works. I have no problem. I got good strength. It's all good. So I'm going to sign off now. If you have any questions, please feel free to write a comment, and I'll answer any question you have as soon as I can. I hope this video helps. This is part 2 of week 12 of my post-surgery on the C3, C4, C5, C6. Okay? All right, guy. Thanks.